Hi, welcome back to Kelly Kuhn PT. I got a question yesterday on my Facebook page about IT band pain, and I wanted to answer it with some tips. I think the most important thing for treating IT band symptoms, and when we say IT band, it's kind of this lateral hip and knee pain. It's this band of tissue that runs down the side of our leg. Is what's actually happening. Okay, for so many years we just thought the IT band was really, really tight, and when we said tight, we thought it meant that the tissues were shortened and they didn't have enough length to do what they needed to do, and we had to stretch them to increase the length of the tissues. Well, we know that that's not the case. The tight IT band feels tight because it's irritated. It usually has plenty of length to do what it needs to do. It may not be comfortable moving through that length, but most times it has enough range of motion to do what it needs to do. So stretching isn't really going to help it. What we need to do is figure out why it's getting irritated and calm it down. So when an area is irritated, it's because the nervous system is not happy with what's going on in the area, and it sends the pain, it sensitizes that area, and it sends pain to alert us to change something. The easiest analogy to think about sensitization is that if you ever had a sunburn and you go into the shower, water temperature is the same as always, but now it hurts. But we know we're not damaging our skin with this water temperature. It's not too hot. It's just that we're sensitized, and our brain wants us to know that we need to protect our skin because it's burned. And that's the same thing that can happen in our body. There's nothing necessarily damaged with the tissues. It's just sensitized, and our brain wants us to know to watch out for that area because it's not happy with the amount of workload it's doing or something that's going on there. And one of the things that may sensitize an area is when we move really in the same way too much, like repetitively throughout the day. So for the IT band, I think what happens is we spend a lot of our day moving our hip into adduction. That's with an AD. So when we move the leg across the body, and we do spend most of our day with our leg across the body. So a lot of us sit with our legs crossed, and there's nothing wrong with sitting with our legs crossed, but it is an adducted position. So we may spend a good part of our day with our legs crossed at our knees or crossed at our ankles, and we're moving into adduction. Then many of us will stand and we'll have our hip kind of kicked out like this. So I would be adducting my right hip. So I'm just kind of, especially moms who have a baby, they'll kind of hang with the baby here. Again, there's nothing wrong with that, but if we spend a lot of our day or most of our day doing that, this might start to get irritated. The other thing we may do that is adduction is when we sleep on our side. If we lay and our legs are crossing over and falling into adduction, we're spending more time in that adducted position. And this for a lot of people is enough to irritate it if the area is sensitized. But then we throw in running and runners. And runners sometimes don't have the appropriate landing pattern, and they may tend to adduct a little bit when their foot hits the ground. And it's not the end of the world, but if you're irritated and that's happening, it might really start to cause a lot of pain during your run. So for example, when the foot hits the ground, instead of being able to stay kind of straight, they let the knee kind of drop into adduction and the hip comes out. Some people might even do that with walking. They may kind of swoosh a little when they walk and the hip is coming out. So you can see how for some people we're spending maybe just too much time in adduction, and then our nervous system gets irritated, and that's why we start to feel pain at times, especially after we run, when we're adducting with a lot of load underneath it. So what can we do about it? Well, I think the first thing we can do is just try to initially back off on how much time we're spending in adduction. I don't want you to be afraid of it. It's not bad for you and you're not doing any damage. You just might be kind of, for lack of a better phrase, poking a bruise. You're just irritating it. So if we can just kind of take a little bit of less time in adduction, it might help to calm down the area. So for example, I try to get patients who are experiencing IT band or glute pain to kind of avoid sitting with their legs crossed. Now you're going to forget. If you're a leg crosser, you'll forget and you'll cross your legs, and that's okay. Just as soon as you realize your legs are crossed, uncross them and go about your day. Just that little bit of changing it and coming out of it at sometimes throughout the day is enough to help, okay? We're also going to try not to sleep on the irritated side and sleep on the other side with a pillow between our legs. Again, if we move during the night, not the end of the world, but just by changing it some, it might be enough to help. When we're standing, we're going to try not to hang on that hip like I showed you before. And if you catch yourself, just pull the hip back in. Or sometimes I'll even have people, if they kind of just can't help it and are just always here all day, just put their foot on up on a stool if they're going to be standing for a long time, just to kind of not let that happen and just change things a little bit. Our brain just likes it when we change and we add new and novel stimulus. And these are all just strategies to do that throughout the day. The next thing we can do is we can start to load the tendons, okay? Or sorry, I forgot the next step. The next step is actually to move our body in the opposite motion, okay? So we know that adduction is bothering us. So maybe if we add in some motion in abduction, which is the hip going away, we might feel a little bit better. And I like to do this with a strategy where we're actually putting some load through the leg too. So in weight bearing. So what we're gonna do is I'm going to have you stand up, and we'll just pretend there's a wall right here next to me. And I know you can't see my arm, but I would put my arm kind of flat on the wall like this so that it's pushing against me. And I'm just going to put my hand on my hip and just shift my hips this way. Okay, so the right leg is the leg I'm working. Here's my wall, so I'll do it on the wall here so you can see. And I'm just pushing, and I'm kind of pushing back with my arm on top. And I keep my knee straight. And we're just moving the hip from this kicked out position to this way kicked in position. Okay, so the wall's just kind of pushing back. All right, and I'll have patients do that throughout the day. And how much they need to do just depends on how much it hurts. So if they're sitting a lot and they tend to cross their legs a lot and it's really irritated, I may have them do it every hour for a few times. If they're not doing so bad, I may just have them do it a couple times a day and before they run. The dose really is the amount you need to do it is dependent on how bad it is and how much it takes for you to feel better. So we're adding that in through the day. We're kind of avoiding the other activities that we actually want to strengthen. And there's a million ways to strengthen the hip abductors. So I'm just going to touch on a couple real basic ones that I like to use. If those don't work for you, though, there's a million different ways to do this. So I oftentimes like to start with isometrics, which is kind of just strengthening the hip without it really moving a lot. So we're going to move into abduction, abduction, and kind of hold it there. So I will do this by taking a band, and I will put it around my knees, and I'll just get into a little bit of a squat, not a big squat, and then I'm just going to keep this right leg is, again, the one I'm working on, just kind of keep it pushed into abduction, AB, away from my body. But I'm not rolling onto my foot. I'm going to back up so you can see my foot. I'm not rolling onto my foot. I'm keeping my foot down, and the ball of my big toe on the ground. I don't want it to roll, so I'm just pushing the hip out. And I'm just going to step in a lot of different directions. Just forward and just keeping that push across. So this now has to work isometrically to kind of hold me. And we know isometric time under tension really seems to calm down irritated tendons. So that's a good way to start. You do that for a little bit, maybe once a day. As we get stronger and the isometrics are really helping to calm us down, we can start adding in more dynamic motions. And we even might progress to where we go into adduction and kind of pull out of it so our body gets used to tolerating adduction. We don't necessarily want to avoid it forever. We want to add it back in and put some load through it and get our body the capacity to tolerate adduction where it doesn't irritate us. So that way when we're running and we're accidentally slipping into adduction, which may happen with our running form or may happen especially when we get tired near the end of a run, that it's not so irritating to the hip. So something I would do for that is called a bowler squat. And with this one, it's kind of more of a deadlift than a squat. I'll just stand on my one leg, and I'm going to kind of bend my hips. I'm going to hip hinge forward, and I'm just going to reach like I'm bowling and see how that brings my leg in, and then I have to control it, pulling it back up. So this would be a more advanced exercise that we use to kind of get us used to that load of running, okay? So there's a lot of other strategies and tips that can go along with this, but this is just a good roundabout way to think about the IT band pain and how I, as a PT, would treat it, and to think about different strategies. one other thing that I would like to touch on is stretching. So we said in the beginning that stretching really doesn't do a lot to help IT band pain, but it also might irritate IT band pain. Because if you think of the traditional stretches, we're all taught to kind of come across our body to really feel this pull and stretch it out. Well, look what's happening. We're moving into adduction. So if you're having IT band pain and you've been stretching and it's not getting better, it's probably time to stop stretching and hold off on that, at least for now. If you really like those stretches, you can maybe add them back later. But right now, we need to stop on them. The other thing is foam rolling. Foam rolling got really, really popular, and I'm not against foam rolling, but it is not my first line of defense for this injury. If you like foam rolling, my rules are, if it feels really good, go for it and do it, but then you want to do your exercises right after. All you've done by foam rolling is you've kind of calmed the nervous system down where it's not so irritated. But that's not going to last if we don't do any movement to solidify it. So if you use that foam roller to calm it down, go ahead, get up, strengthen like we just talked about, and hopefully you'll take whatever you feel better from that foam roll and make it last a little bit longer. It's a better way to get you moving. If that foam roller is irritating you and making you feel worse, or it doesn't make you feel any better, don't do it. It's not really helping that much. There's a much better way to work on it that doesn't involve foam rolling, but if you like it, you can keep it in your program, but it's not the end-all be-all of IT band pain. So again, that's kind of my big spiel on IT band pain and glute, and I'm sure I'll touch on it again in future blogs. I hope this helps. And if you have any questions, please check out my website, kellycoonpt.com. Thank you.